Cheryl is an integrative health author and natural medicine practitioner who truly has a passion for helping people bridge the gap between mainstream and also natural medicine. She is an expert on natural health, a nationally recognized speaker who has been interviewed by prestigious organizations such as the New York Times, the Wall Street Journal, and Prevention Magazine. Cheryl is a well-known advocate of bridging the worlds of mainstream and natural medicine to achieve optimal health outcomes. Cheryl also serves as the Chief of Scientific Affairs and Education for Europharma. So please join me in welcoming our very special presenter, Cheryl Myers, for a great discussion on the dangers of prescription and over-the-counter drugs.
Well, hello, everyone, and thank you so much for joining us today to learn more about how we can best protect ourselves and protect the ones we love. And that's in our discussion, having an intelligent and balanced discussion about the dangers of prescription and over-the-counter drugs. Are they necessary? Are they always necessary? And are there natural agents with more levels of safety that we can use in their place? So I think the first question we ask ourselves is, are we better off with or without? Well, I err on the side of safety. I'd say we're better off with prescription drugs. Drugs save lives and drugs ease suffering. If I am in a horrible car accident and I'm taken to a trauma center, I want the drugs that are going to put me to sleep and anesthetize me so they can do the surgery to repair my broken bones. But there's also the dark side of drugs, in that the way that they are created and the way that they work within the body can also cause extreme suffering, a whole host of unacceptable side effects, and in the worst of worst-case scenarios, drugs can even cause death. The top 5 prescription drug categories in America include the statin drugs. These are used to lower cholesterol. An example of that is Lipitor. There's 255 million prescriptions written in the United States for Lipitor every day. Now, that doesn't mean 255 million people are taking Lipitor. A prescription is generally written for 1 month's supply. So 255 divided by 12, we're looking at about 20 million people in America that are taking a statin drug to lower their cholesterol in the sometimes misguided belief that it's going to prevent heart attack and stroke. Antidepressants, Cymbalta, for example, used for depression and anxiety, 253 million prescriptions written every year. So again, about 20, 22 million people a year that are using these products. Narcotic analgesics, so this opens a whole can of worms. Things like oxycodone and Vicodin are used for pain and chronic pain. 244 million prescriptions written every year. Beta blockers for heart disease and high blood pressure, one example might be Lopressor, about 191 million. And the ACE inhibitors, which are used for high blood pressure and also sometimes for migraines, one example of which is Lotensin, about 168 million prescriptions written every year. So you can see that a lot of individuals are taking prescription drugs, and you can also see the drugs are big business. Let's start out with pain control, because I believe that we all, at some point in our life, experience some level of pain in which we go and seek of some type of relief. You know, there's always little pains that we shake off, but sometimes pains are severe enough that we want to use something to help us address our pain. Currently, 25 million Americans suffer with daily pain, and 23 million Americans report a lot of pain. And there's a huge rationale behind this. We could talk about the inflammatory triggers in our country. We could talk about obesity and overweight that puts the body in a pro-inflammatory state. We could talk about the way that we address pain that actually creates higher levels of pain. So I don't think that we have time during this webinar to go into that deep a detail. In fact, maybe we should have another get-together where we just talk about why is there an explosion of pain in a country that has the highest levels of investment in healthcare on the planet. Now, that also means that we're investing in a lot of over-the-counter and prescription pain relievers. And let's just go through them for a moment. Here's some examples, and this is not all-inclusive. Acetaminophen is the generic that you find in the Tylenol products, but acetaminophen is the generic name. It is the #1 cause of acute failure in the United States. Acetaminophen is extremely dangerous. Sometimes it's held up as the safe alternative because it's gentler on the stomach, but acetaminophen destroys the liver. It causes liver damage. It also reduces the ability for the liver to make glutathione, and that in and of itself can cause huge levels of problems in health. When we look at the other class, which are called non-steroidal anti-inflammatory drugs, or NSAIDs, 16,500 people die every year. So a small city is wiped out every year from the use of ibuprofen, Motrin, Advil. When you put them all together and include aspirin and Aleve and naproxen sodium and the prescriptions like Celebrex, that number jumps to 30,000 people. Can you imagine if dietary supplements killed 30,000 people a year? It would be a national outcry, and yet we seem to sweep this under the carpets. Not only do nonsteroidal anti-inflammatory drugs destroy the stomach lining and the intestinal lining and cause ulcers, worst case scenario, perforated ulcers, which lead to peritonitis, not only do they cause chronic bleeding in the gut, which can lead to anemia, they also reduce kidney function. And when you reduce kidney function, you double and triple your risk of heart attack and stroke. To me, these are unacceptable side effects. So why is acetaminophen so bad for the liver? Well, first, I got to tell you, it's in everything. There are more than 600 prescription and over-the-counter drugs that contain acetaminophen, brand name also known as Tylenol, either alone or as part of a combination. Because of its reduction in the creation of glutathione in the liver, glutathione is the most important antioxidant and detoxification compound our body makes. And lack of glutathione is related to a whole host of diseases, including Parkinson's disease, Alzheimer's disease, heart disease, chronic infections, neurological disorders. But there's also, in addition to that, an autism connection that researchers are starting to investigate if the number of times that mothers, while pregnant, use Tylenol or acetaminophen products increases the risk for having a child on the spectrum. And they have found in one study that when they looked at women who took Tylenol during pregnancy, over 40% of women during their pregnancy used acetaminophen. And they found that there was a significant increase in hyperactivity and impulsivity, and also a significant increase in autism and autism spectrum disorders in children. Now, this is still under investigation. One could also argue that maybe the mothers were using acetaminophen because of some underlying health condition that itself contributed to these dysfunctions. Whatever the case may be, just that it is something that we need to be paying attention to every single day. You also need to know that acetaminophen does relieve pain. That's why people sell it. That's why they buy it. It relieves pain, and it does reduce fever, but it does absolutely nothing for inflammation. So if you're taking acetaminophen or Tylenol for chronic neck or chronic back or arthritis somewhere in your body, it may help with the pain by poisoning some of those pain pathways, but it's doing nothing whatsoever to treat the underlying condition. Now, when we go back to talking about the nonsteroidals, and that's aspirin, ibuprofen, Motrin, naproxen sodium, Aleve, Advil, we see that they, too, reduce pain. And they do something that Tylenol doesn't do or acetaminophen doesn't do. They reduce inflammation. However, they're also extremely dangerous. It inhibits COX-1 and COX-2. So when you inhibit this, it causes bleeding in the stomach, increased risk of heart attack and stroke, intestinal bleeding. When you inhibit COX-2 by dropping a nuclear device on it, it raises the blood pressure, which causes an increased risk of heart attack and stroke. And some studies are even showing that it may play a role in increasing tumor cell growth. Now, opiate medications, opiates, we hear of opium. That was the oldest opiate medication from poppies from a very long time ago. Opiates are what they call narcotic analgesic, and they have high addiction potential. They reduce your feelings of pain very well. But opiates also do nothing whatsoever to address underlying inflammation. So they're like putting a Band-Aid over your problem without doing anything to help cure the wound that's causing the pain in the first place. Because we are a nation living in pain, the sales of opiate drugs have quadrupled. That's 400% in the last 15 years. Pain's about the same, so they're really not doing a very good job of addressing that pain. 50% of the opiate prescriptions, like your Vicodins, Percocet, Percodans, are coming from primary care providers. So what can we do instead for natural pain relief? Well, curcumin, which is an extract of turmeric, has been shown to work as well as some of these drugs. It works as well as diclofenac sodium. It works as well, which is sold under the brand name Voltaren. There's studies that show it works as well as ibuprofen. There's even studies that show that in combination with Boswellia, it works as well as the prescription Celebrex, celecoxib, the #1 osteoarthritis prescription drug in America. Here's a study that looked at using curcumin for 6 weeks. Now, not turmeric. That's something that I often, when I'm talking to patients or when I'm talking to consumers, they get quite confused about the differences between turmeric and curcumin. Turmeric is a wonderful plant and a fabulous food. And if you like it, I hope you're using it every single day. But there's only a tiny little bit of curcumin in turmeric, about 2% to 5%. So in a full 1,000 milligrams of turmeric, you may be getting as little as 20 milligrams of curcumin. And as my grandfather would say, that's like spitting in the ocean to raise the tide. So curcumin is far more concentrated than turmeric. And you also need to look at enhanced absorption to make sure that you're getting enough on board to have medicinal results. In this study, it was a comparison between a 6-week study in walking and going up and down stairs, and they found that the individuals who used curcumin actually had better improvement than ibuprofen in both walking and also pain on using the stairs. Here's another study. This was done on BCM95 curcumin. That's the most clinically studied enhanced absorption curcumin in the world. The way they enhance absorption is to use turmeric essential oil, and the turmeric essential oil not only boosts absorption but provides additional compounds that many researchers feel are quite therapeutic. This study was rheumatoid arthritis, 500 milligrams of this special curcumin twice daily, or 50 milligrams of Voltaren, diclofenac sodium, twice daily for 8 weeks. And then they assessed the scores of individuals with rheumatoid arthritis. They found that both achieved equal reductions in disease score, so it worked as well as the prescription drug. But look at this dropout rate over here. This is what's amazing to me. Remember when we talked about adverse effects? Well, 14% of the people in the drug group had to drop out of this study because of the severity of their adverse effects on the stomach and the intestines. Look at this curcumin number, 0. So even though they both had equal improvements in pain relief and functionality in people with rheumatoid arthritis, I would absolutely start with this unique curcumin versus the drug because you don't have to worry about the adverse effects. Curcumin has side effects I can live with, like prevention of cancer and heart disease and even dementia. Here's a really interesting study. It was published in Osteoarthritis, and there's also, it was presented at the Osteoarthritis Research Symposium International, and it was on individuals with arthritis of the knee. And they used a combination of that unique absorption curcumin with the turmeric essential oil and a purified boswellia in combination, compared to celecoxib, which is the generic of Celebrex. They looked at joint pain. Well, in the curcumin boswellia group, at the end of the study, only 21% still had moderate pain. The rest were mild or no pain. But in the celecoxib group, a whopping 50% were still in the moderate pain category. So twice as many people had significant relief versus the drug group. At the end of the study, the curcumin boswellia group, 7% were still rating their joint line tenderness, the pain on their joints, as in the moderate category. The rest were mild or non-existent. 21% in the drug group still rated their pain in the moderate category. That's 300% worse performance. Walking distance. At the end of the study, 92%, almost everyone in the herb group, was able to walk 1,000 meters without pain, whereas only 85% in the drug group. So this is an instance where an herbal combination performed in a clinical study better than its prescription drug counterpart without any of the serious adverse effects. So what to take away from this? Make sure you're getting curcumin and not turmeric. Look for curcuminoid standardization on the label. Turmeric essential oil is one safe and effective way to increase curcumin absorption. And when you look at adding boswellia, if you're trying to replicate the study, make sure it's standardized for a compound called ACPA. Now, the next class of drugs I want to talk about address diverse issues. They're used for allergies, they're used for stuffy noses, they're used for bladder problems and incontinence, they're used for sleep problems and insomnia, and even the common cold. This class of drugs are called anticholinergic drugs, big class of drugs. Now, anticholinergic drugs, let's take the word apart. Anti, meaning against, choline, a nutrient needed by the body, ergic usually means energy or energizing. So this is against choline in the body. What are some of the ways that choline is used? Well, perhaps the most important way that choline is used is in the creation of the neurotransmitter acetylcholine. Nerve cells combine choline and acetyl-CoA to make this important neurotransmitter. Acetylcholine reaches receptors, triggers muscle activation. It also does many other functions within the body, including helping our cognitive processes, helping our brains think and transmit signals from one brain cell to another brain cell. So it's extraordinarily important to learning, attention, and memory. So there's an enzyme called acetylcholinesterase that breaks down the acetylcholine when it's done with its job and turns it back into choline, and it's recycled to make more. So it's a nice, healthy cycle in the healthy body. But what do you suppose happens if you block choline in the body using an anticholinergic drug? Well, you start to have problems with muscles. You start to have problems with the heart. You especially start to have problems with the brain, and you start to have problems with healthy breathing. Drugs that block acetylcholine, anticholinergic drugs, are used to treat overactive bladder, muscle spasms, allergies, sleeplessness, symptoms of Parkinson's disease, COPD, asthma, nausea, vomiting, morning sickness, but at what cost? Anticholinergics are rough on everyone, but they are particularly bad for older adults. For individuals, compared to no use of anticholinergic drugs, for individuals using anticholinergics for a year, it raises their risk of Alzheimer's disease by 19%. If they use them for over a year but less than 3 years, it raises the risk of Alzheimer's 23%. And if you are on these drugs long term, raises your risk a whopping 54%. Now, this wasn't published in the Ma and Pa journal down the street. This was published in the Journal of the American Medical Association, JAMA, Internal Medicine. A separate study found that taking one moderately anticholinergic or two mild ones reduced the functionality of older adults, like their ability to bathe and dress themselves, by a third, 30%. And they were 35% more likely to have problems with complex tasks like managing their medications or paying the bills because it interfered with their thinking. This is a class of drugs that is used widely and indiscriminately. You can get them by prescription, and you can always buy them over the counter. So, for example, here's some drugs with anticholinergic activity. Antihistamines like chlortrimeton, Alachlor, Benadryl. How many times do we see Benadryl added to everything? Certain types of antidepressants called tricyclic antidepressants. Now, these aren't as popular as the current antidepressants like your Prozacs and your Zoloft. That's a different class. But this earlier class is still somewhat in use. Elavil, Anafranil, Tofranil, Pomalor, Librium are still anticholinergic drugs. Cardiovascular, Lasix, a common drug used for people with severe hypertension and to get fluid off the body. Lanoxin for heartbeat regulation, Adalat, Gastrointestinal, drugs like Lamodal to stop diarrhea, Tagamet, and Zantac sold over the counter to reduce stomach acid. Anti-Parkinson's diseases, drugs like Simitril, Akenaton, and Cogentin. Antipsychotic drugs used for people generally with schizophrenia, Clozaril, Zyprexa. People with urinary incontinence are going on Ditropan and Datrol and Vesicare. And people with motion sickness, Bonine, Antivert. These are not even an all-inclusive list. If you would like to see drugs with anticholinergic activity and do some research on your own, just Google it and see what you get. So ongoing use of these drugs every day can have horribly deleterious health effects in the body. Diphenhydramine, especially Benadryl, is everywhere. Now, diphenhydramine began life as an allergy drug because it reduces histamine. It's also an antihistamine. When you are exposed to something that you're allergic to, it creates this huge histamine response in your body. It causes your eyes to swell and water and your nose to get all stuffy. It can make your skin itch. Sometimes you break out in hives. So Benadryl started its life, diphenhydramine started its life as an allergy drug. But what they found is that it has an unfortunate side effect. It makes you very, very sleepy. So some marketing genius got the idea. So many people have trouble sleeping. Let's start adding Benadryl, which is an allergy drug, to sleep medication to help people sleep at night, to knock them out. Now, if you're allergic to something and you get exposed and you need to take a couple of doses of diphenhydramine to get that allergy out of the dangerous realm once a year, you're really safe. That's really okay. But if you're using diphenhydramine or Benadryl every single night to get to sleep, that is not okay. So we've got Excedrin PM, we've got Tylenol PM, Benadryl Allergy, Z-Quil, Bayer PM, children's triminic syrup uses diphenhydramine, an allergy drug, for its side effect. It makes you sleepy. So in some of these, this is just really bad piled upon bad. So you're taking Tylenol every night. Sometimes you don't even need the Tylenol. You're not even in pain. You're taking it to get to sleep. So you're depleting the glutathione in your body and risking liver damage and increasing your risk of Alzheimer's and other diseases by diminishing the choline in your body. I believe that, quite honestly, except for using Benadryl on rare and emergency occasions for an allergy, I would get rid of every single one of these products on the market. There's just so much better that we can do for people. 90% of Americans have been found to be deficient in choline, and up to 50% of Americans have genetic variations that make them not very good at processing the choline that they get. If you have choline deficiency, you're going to notice fatigue, brain fog, memory problems, muscle damage, and weakness. And so for many of you, it may make sense to take a choline supplement. The recommended daily intake is a minimum, now this doesn't mean optimal, but a minimum of 425 milligrams for women, 450 if you're pregnant, 550 for women who are breastfeeding, and 550 for men. Now here's some alternatives to anticholinergic drugs. Environmental allergies. There's a medical device from Great Britain that has some excellent clinical evidence, some published human clinical trials, and I just selected one for our presentation today. It's a very fine cellulose powder that you spritz in your nose that helps to block the contact of the allergens to the allergy receptors. I often say it's like wearing a surgical mask on the inside of your nose. In some of the studies, they found that it blocks a solid 80% of dust mites for people who are allergic to dust. When you look at a clinical trial, it found that 87% of the people using the nasal powder for their allergies rated their treatment as good or very good versus only 24% in the placebo group. It's been approved by the FDA for use in pet allergies, dust allergies, grass allergies, and hay fever and pollen allergies. One puff in each nostril a couple of times a day. So you have no severe adverse effects because it doesn't work in your system. It just works by blocking your exposure to allergens. It's very safe. It's been approved for children down to the age of 18 months and even pregnant women. It blocks very quickly the allergy receptors and goes to work immediately. So how much better is that than taking Benadryl every day for your seasonal allergies? For cold and flu combinations, I really love elderberry coupled with vitamin A. When we look at elderberry, one of the clinically studied forms is a unique elderberry found in Austria called Haschberg's Austrian elderberry. They just published a clinical trial just this year of 312 people who were flying from Australia to overseas destinations. Well, if any of you have been to Australia, there's nowhere that you're going to go quickly. You're going to be on that plane for a long time. So you are rebreathing the air. You're in tight quarters with individuals who may be carrying different pathogens. Colds and flus are rampant. How many times have you or your friends complained that every time you take an airplane trip, half the time you end up with a cold or the flu after the fact? So they gave everyone this Haschberg Austrian elderberry, and they had 50% reduction in cold and flu as compared to the placebo group. And even in those individuals who did get sick, their illness was reduced by a whopping third compared to the placebo group, and their symptoms were not nearly as severe. So since I read this study, I don't get on an airplane without Haschberg Austrian elderberry combined with other nutrients that the immune system needs to be strong. Vitamin A is one of those. Vitamin A, not in its beta-carotene form, that's a precursor, but in the retinol acetate form. It's the most concentrated form, and it has very strong antiviral activity. Yes, C, D, zinc, calcium, magnesium, etc., those are all useful. But when you put elderberry together with highly concentrated vitamin A, you can get some downright miraculous results in preventing colds and flus and or getting over them quicker if you become ill in the first place. For cough, instead of using some of the dextromethorphan over-the-counter drugs that are on the market that suppress coughs, I love thyme and ivy because it doesn't suppress the cough. The cough is a healthy instinct of your body to get fluid and mucus out of your lungs. Coughing helps to prevent bronchitis and pneumonia. If you leave that stuff in your lungs, there's a technical term for it. It's called gunk. If you leave all that gunk in your lungs, it's a perfect breeding ground for bacteria and viruses, and so your cough or your cold turns into something far more serious. So if we want to make ourselves healthier and reduce coughing, what we do is make the coughing better and more effective. So you can cough once instead of 25 times. So the long-term effect of using thyme and ivy for your cough is you do reduce how much you cough, but you do it in a healthy way. You're not suppressing the cough. You're just helping the body get rid of the fluid and the mucus in the bottom of the lungs more effectively so you don't have to cough as much. A clinically studied combination that relieves bronchial spasms and reduces the urge to cough is about 250 milligrams of thyme and ivy extracts. I especially like the ivy that's standardized to cineol. For bladder problems, instead of those anticholinergic drugs that people get placed on and left on for decades to help with their bladder incontinence, I really like Angelica archangelica from Iceland. This Icelandic varietype, this genotype in Iceland, is a little bit different than what grows in Scandinavia or in other countries. Some people theorize it's because of the volcanic soils. Some believe it's because it's been isolated for a long time. Some point to the fact that in the summertime, Iceland has 24 hours of daylight. Regardless of what makes this an excellent, potent herbal compound, there are clinical studies that have shown that it reduces the number of times for nighttime awakenings and helps individuals have better bladder capacity. Fewer trips to the bathroom at night means better sleep and better rest. And in the daytime, it means you reduce urinary incontinence. That means the involuntary loss of urine. Most women past the age of 40, especially if they've given birth, have at least a little bit of involuntary urine loss when they cough or they sneeze or they run or they lift something heavy. Some women have a lot, and it's not a life-threatening disorder, so why would you use a drug that has life-threatening adverse effects? Alzheimer's disease is, by the way, a terminal illness because it does cause death sooner than if you didn't have Alzheimer's disease. It eventually affects the brain that it can no longer function. If the brain doesn't function, the body doesn't function. So a lot of people don't think of Alzheimer's disease as a terminal disease, but it is. So why would you risk getting Alzheimer's disease when there's effective herbal compounds that can help with some of these embarrassing problems, like a little bit of urinary loss with coughing or sneezing, that's called stress incontinence, or the inconvenience of getting up several times at night, whether you're a man or a woman, to use the bathroom. This can make a real difference. Now, for sleep and anxiety, there's a couple of ways to approach this. One is if you're tense and you are worrying about something and you are thinking, you can't let go of some negative thought, that means that anxiety is interfering with your sleep, and you need to address that anxiety so you can listen to your body's own natural sleep signals. There is an extract of echinacea, and you're going to say, what? Echinacea is for immune system. Well, it turns out that there's a tiny amount of a compound of an echinacoside in echinacea that has been clinically shown to decrease anxiety scores versus placebo. In fact, after only 1 day of use, dramatically decreased anxiety scores. The 16% decline is after only 1 day of use. With ongoing use, it can reduce anxiety by as much as 2/3. In other studies, it's been shown to be equal to or superior to prescription medications like Librium and Prozac and Valium even. So it's an excellent product that doesn't make you sleepy, but the reason I mention it in sleep is because if you're anxious, you're not going to sleep well. So many individuals who have mild to moderate anxiety, I encourage them to take a dose of this anti-anxiety compound at bedtime or an hour before bedtime. They're going to sleep so much better. For people who have ongoing anxiety that interferes with their life every single day, I put them on a schedule of maybe 2 or 3 times a day. There's also individuals who really only need it at bedtime. Now, if you're just looking at healthy sleep, you're not necessarily tossing and turning because you can't let go of a negative thought, you just have trouble relaxing and going to sleep, I really love the essential oils. But you have to make sure that these are essential oils that are approved for internal human use. So work with companies that know what they're doing, that have their good quality assurance practices and quality control practices well in hand. But when you look at mandarin, lemon balm, ravensara, and lavender, you put those together, and it makes a huge difference in helping you relax at night and go to sleep. Again, half hour to an hour before bedtime. There are companies that sell these in capsule formulations. I like the ones that are suspended in olive oil. I know there's some companies that are selling, for example, lavender oil in canola oil. I'm not a big fan of canola, so make sure you pay a little bit of attention to the other ingredients as well, but you'll be very pleasantly surprised at how well you can relax and sleep when you use this combination of essential oils. Now, cholesterol is a big topic. A lot of drugs sold for high cholesterol levels, and I understand why this is, because people want to have a number where they feel safe. If my cholesterol is under 200, I'm safe. I don't have heart disease. I'm not going to die of a heart attack. If my cholesterol number is over 200, oh my gosh, I better by golly be taking medication for the rest of my life to get that number down, or I'm at risk. So that's kind of the way that the advertising agencies have positioned it, and sometimes I believe the doctors think that way as well. But the truth of the matter is 50% of heart attacks happen to individuals whose cholesterol is in the, quote, normal range. There's a lot more to heart disease than a single number of where's your cholesterol. For every person who has a heart attack, quote, prevented by a statin drug, 2 or more people suffer liver damage, kidney failure, cataracts, extreme muscle weakness, a 50% increase of diabetes, a 25% increased risk of prostate cancer, 26% increase of nerve damage. To me, these are unacceptable adverse effects. There are so many other things we can do to help individuals who are at risk for heart disease without having to use drugs that cause such severe, life-changing, and life-threatening adverse effects. Cholesterol is vital for brain function. It protects brain cells against free radicals. It's used to create cell membranes. Cholesterol is the backbone upon which our sex hormones, estrogen, testosterone, progesterone, even our adrenal hormones, cortisol, are all made on a backbone of cholesterol. If you wipe out the cholesterol, you're wiping out the raw material the body uses for some pretty darned important functions. And this may surprise you as well. It's necessary for vitamin D. A lot of you may think that you absorb vitamin D from the sunlight. You do not. Would that it were that easy. The truth of the matter is that when you go outside and the sunlight strikes your skin, it triggers a reaction in these little cells called melanocytes to create vitamin D. So it's the trigger, flips the switch, but your body has to make the vitamin D. We do not absorb it from the sunshine. So I'm all about going out and getting some good sun exposure. I do not believe in sunburns. Those are damaging and increase your risk of cancer. But I do believe in sunlight, and I do believe in sunshine. So vitamin D synthesis occurs in the body. What does vitamin D, how is it made? Well, one of the first ingredients is cholesterol. So when you wipe out cholesterol and drive it down in the body, you also reduce vitamin D synthesis, and that makes you more at risk for bone fracture and bone problems, hip and joint replacements. Vitamin D also, if you reduce it too low, if you don't make enough of it, higher risks of a variety of cancers as well. In fact, in 2008, there was a study of adults aged 85 and older, which, by the way, is the fastest growing population segment in America because people are living longer. So individuals 85 and older, and they found those with the highest total cholesterol and the highest LDL, which we consider bad cholesterol, had the highest scores of tests of memory and memory function. The real problem with cholesterol is that it's used as a Band-Aid in the lining of our blood vessels. So stage one is infiltration of the LDLs into the healthy blood vessels that's caused by an inflammatory process. Stage three ends up with atherosclerotic plaque forming, which narrows the lumen of the artery, which makes it more prone to a blood clot getting stuck and causing a heart attack or a stroke or a DVT, which is deep vein thrombosis, or pulmonary emboli. Now, so when we start with the infiltration process of the LDLs, we're starting with inflammation and we're starting with chronic irritation on the interior lining of the blood vessel. Excuse me. So blaming cholesterol for heart disease is like blaming the Band-Aid on your knee for the stitches you got because you fell down on the sidewalk. So what we really need to do is pay attention to how to make the heart healthier. And I really love this is not an all-inclusive list. There's lots of wonderful nutrients to help with healthy heart. But one I want to call out, because you may not have heard of it, it's called AMLA. It's from India. It's been used in Ayurveda for a very long time. The technical name is Indian gooseberry. AMLA, in a study of AMLA versus Atorvastatin, that's the brand name of Lipitor in people with diabetes, AMLA was equally effective as Lipitor. It increased glutathione levels, that's a protective antioxidant in the liver, by 31%. It decreased C-reactive protein, which is a crucial marker of inflammation, especially as it relates to heart health, by a whopping 63%, and increased HDL levels by 17%. That's protective cholesterol. And it has no significant adverse effects. A dose used in the study was 1,000 milligrams a day. So if you have concerns about your cholesterol, you have inflammation and maybe your blood sugars and blood pressure are creeping up, yes, you do have to take some steps. But I believe that statin drugs should be a last resort, not a first intervention. AMLA also prevents plaque formation in the blood vessels. Now this first photograph is control, normal diet, no AMLA. The second is a high cholesterol diet plus AMLA. So you see that it doesn't differ very much from the control. But when you look at the third, this is a high cholesterol diet with no AMLA, so very unhealthy diet. And look at the bulge that's created, that we start to see huge amounts of cholesterol depositive that we didn't see when we had AMLA on board. Some other natural alternatives for heart, grapeseed extract. I love grapeseed extract. It reduces blood pressure levels. It can prevent oxidation of LDL cholesterol, so it helps keep cholesterol in its healthy form instead of allowing it to convert into its oxidized form, which is more what the body uses for deposition on the inside of the blood vessels. And it reduces triglyceride, which I think are actually more indicative of heart disease than is total cholesterol, by a whopping 15 to 20%. If you are going to use grapeseed, make sure it is standardized to be tannin-free, that it's all standardized to be small, what they call OPCs, oligomeric proanthocyanidins. Those are the key compounds in grapeseed. And if they're not standardized to be small enough to be absorbed, you're going to pay a lot of money to get something that may not provide you with the health benefits you desire. Pomegranate oil. I'm also a huge fan of pomegranate. Now, you may choose to take it as a drink. I love pomegranate as a drink, but quite honestly, my body can't handle that level of sugar every single day. So I prefer to use mostly pomegranate as a supplement. In a clinical study, blood pressure was lowered by 12%. Other studies have shown even more still. But this is what I love, a whopping 30% reduction in the atherosclerotic plaque. In the control group that didn't get pomegranate, they actually saw their plaque increase by 9% versus a 30% reduction in the pomegranate group. This is just unheard of. You can't do this with a prescription drug or an over-the-counter drug. To actually reduce the atherosclerotic plaque, this is just amazing. So drugs are not always the answer. Are they sometimes the answer? Yes, they are. But they should be held in reserve. I believe that we can reduce our use of prescription and over-the-counter drugs by as much as 90% and be healthier for it. I'm not sure that some of the high-powered drug lobbyists and prescription drug companies would agree with me because it is true there's a lot of money to be made in this industry. But from a medical perspective, prescription medications are vastly overused. They should be held as a last resort and not a first intervention in most instances. So they are indeed both an angel and a devil. The best course of action is to consider wisely, work with your practitioner, ask questions. If I don't take this prescription medication, what will happen? Use food, exercise, lifestyle, natural medicines, and supplements. Use those first to try to get a handle on whatever threat there is to your health. Because dietary supplements, in general, have far better safety profiles, and they can both prevent disease and help to resolve existing disease. And there have been study after study that shows that they outperform many overused drugs. So I thank you kindly for your attention today as we learn about interventions that can work as well as or better than over-the-counter and prescription drugs, and ways to avoid these very often life-threatening adverse effects. So I wanted to make sure that we had a little bit of time to answer some questions. I'm going to turn this back over to our host, Lexi Locke. But I do want to point out that if you have found this information interesting, if you want to review it again, or if you have a friend that you think would find this interesting, please send them to youtube.com/Terry Talks Nutrition. Our Terry Talks Nutrition webinar series, all of our webinars are archived there that you can listen to free of charge at your leisure. So thank you so much.
Thank you, Cheryl. That was some truly empowering information. A lot of really great scientifically backed natural medicines, like you said, outperform or do as equal to the prescription medications. So that was really great information. So again, if you are on via computer or smartphone and you have any questions, you can go ahead and start sending those via the chat box. I do have a couple that have come through already for the information about curcumin and boswellia for pain. Some people were, again, a little bit confused on the difference between turmeric and curcumin and what they should be looking for in a curcumin supplement if they are going to a health food store to try and find one.
Well, you know, turmeric, unfortunately, in the press and in mainstream media, and if you watch Dr. Oz, they talk about turmeric because people recognize that word. It's a spice that's been around for a very long time. Turmeric is wonderful, but it's a food. It's not the natural medicine. You have to have curcumin that's extracted from turmeric. The reason I say this is if you have a cold and you want to take vitamin C, when you go to the health food store, they don't say take 17 oranges and eat them every hour or two. You buy 500 milligrams of vitamin C. So when you're using it as a healthy food, yes, by all means use turmeric. But when you're using it as a medicine, you have to cut to curcumin in order to get the amount on board that clinical studies have shown are effective. That said, curcumin is not easily absorbed, neither is turmeric. That's why the next generation of products are all enhanced absorption curcumin. There's more than one way to enhance absorption, so please be very careful and read the labels. There's good ways to enhance absorption and ways that I think are not so good. A little bit on the Frankenstein side. That's why a couple of the clinically studied ingredients that I referred to, or some of the studies on specific issues, I talked about the BCM95. That's one way. That uses turmeric essential oil to boost absorption. It's the most clinically studied enhanced absorption curcumin in the world, but I want people to be aware there's other ways to boost absorption as well.
All right. It looks like we have a question on someone trying to help their significant other get off of opiates, and they want, to see what type of natural interventions might be out there for someone struggling with chronic pain.
Well, that's really, really difficult. And that's one of the reasons why opiates are so dangerous, is because they teach the brain to behave differently. The brain likes what we call homeostasis. The brain likes balance. And so if you flood the brain with narcotic analgesics, which you can do using opiates, at first you get this wonderful sensation and this wonderful pain relief. But your brain's like, oh my God, this is a little bit too much, dial it down. So the brain starts to rein in some of its own natural feel-good compounds. That's why people suffer so abysmally when they're trying to withdraw from opiate medication. So first I would say get somebody who's really good, some natural practitioner, or if you have an integrative person in your area that can help, and you need to wean off extremely slowly, very, very slowly. Then I would use like the combinations of curcumin with the turmeric essential oil, boswellia. I would get some of these things on board in order to help with some of the inflammation and pain that's going on. You also may need to look at anxiety reduction, so that echinacea might be useful as you're going through this process. But still, it doesn't happen without a lot of discomfort, and it needs to be, if you have the opportunity to work with someone who knows what they're doing, it's certainly a lot easier with professional guidance. It's not something that you can just stop, because if you just suddenly stop opiates, the pain comes rushing back, and it's a very big pain. And it's hard to get a handle on, because remember, the pain is, your brain has withdrawn a little bit because it was flooded with all these opiates, and it didn't like being overwhelmed, so it reined in some of its own feel-good compounds. So when you take that away, it takes a while for the brain to snap back into making those feel-good compounds again. So I don't mean to be pessimistic. Absolutely, this can be done, but it's not just a matter of, well, I've decided that I'm going to use something else and it's going to address my pain. It's a matter of also dealing with helping the brain come back so that it's making its own healthy, feel-good compounds again.
Excellent. That's some really great information. I do have something that's a little bit off topic, but on the topic of bladder issues that we were talking about, someone looking for a little guidance for interstitial cystitis.
Interstitial cystitis can be it can be mild or it can be devastating. I really do like the Angelica Archangelica. It's not perfect. Some people get excellent relief, some people not so much. It's something you need to experiment with. The clinical studies are more on bladder capacities, but a lot of integrative practitioners have used it in order to help quiet down the overactive nerve signals that are found in the bladder.
Excellent. And I know we didn't talk necessarily about diabetes today, but someone's looking for, they're on metformin. Is there anything natural they can add in combination, or something maybe they can transition to naturally instead of the metformin at some point?
Well, it is important to get your blood sugars down. I mean, that's not just some kind of myth in the medical world. If your blood, I mean, I don't think it's as important to get your blood cholesterol down, but I absolutely believe it's important to get your blood sugar down because nothing irritates your blood vessels more than sugar, excessive levels of sugar. And there's so many bad things that can happen down the road if you don't keep your blood sugars where they need to be. It sounds like your doctor's using an awful lot of stuff to try to get you there with your blood sugars, or it may be that they are using it for metabolic syndrome. You have the whole shebang. I would say that there's some products out there. There's a clinically studied Hintonia latiflora. You might need to Google that. Hintonia from Germany. I know it was just made available in the United States for the first time. That's excellent at blood sugar balance. If you're using these drugs for metabolic syndrome, I would add into that some coenzyme Q10. I personally like the ubiquinol, the active form, better than the ubiquinone. I would add in some omega-3 fatty acids, and I would probably do some grapeseed extract to try to rein in the blood pressure. So unfortunately, when you have some of these complex groupings of symptoms, I wish there was something. I wish we could all take a pretty pink or purple little tablet at the beginning of every day and it would take care of everything. But sometimes it needs a combination of diet, lifestyle, and a supplement regimen to help get you back on track again.
Excellent. Thank you very much. And someone had a question. I know we talked a little bit about sleep and anxiety issues on that with the echinacea angustifoliae, but someone wants to know what are your opinions on ashwagandha and what would be a good dose for a relatively healthy person?
Well, I personally love ashwagandha. And you want to make sure that it's standardized to compounds called withanolides because if not, you're not sure you're getting a full potency. So I like you know, as you can tell, I come from the medical world. I like products that are clinical studied, that they've used real doctors and real studies with real patients and monitored their results and published them in peer-reviewed journals. That, to me, gives me better guidance on how to best use these products. So I like the clinically studied ashwagandhas that are out there. Now, for me, yes, ashwagandha is a stress reliever because it's an adaptogen. It helps the body respond better to stress. So if you have a lot of stress in your life and it's interfering with your sleep, if you use ashwagandha throughout the day, you probably will sleep better at night. However, ashwagandha is also energizing, so I wouldn't take it right before bedtime because if you, because it can also help you with energy. So I would use ashwagandha if I were using it a couple hundred milligrams, maybe twice daily. I would do that probably morning and noon or morning and afternoon. I probably wouldn't take it too close to bedtime. But you're right. Overall, it can help reset some of those stress hormones and you will sleep better.
All right. Now, we were talking about some of those anticholinergic drugs and how they deplete choline in the body. Someone wants to know what you think about acetylcholine supplementation.
Unfortunately, acetylcholine supplementation does not work. If you can create a drug that gets to the brain as acetylcholine, you will make billions and billions of dollars because nobody's been able to do that yet. Because when you have Alzheimer's disease and certain other dementias, the amount of acetylcholine in the brain is dramatically reduced. And many scientists believe that if you can restore that, a level of acetylcholine in the brain, you'll do much better. You'll have much better cognition and much better thinking. Right now, the best way to improve acetylcholine in the brain is to make sure that you're not destroying choline in the body and to supplement with choline so that you have plenty of raw materials so that you hope your brain can do its job. There's also some, if you are someone you love is already suffering from dementia, there are some natural herbals that help block an enzyme called acetylcholinesterase. That's the enzyme that takes acetylcholine out of circulation. So if you slow down the activity of the enzyme, it leaves the acetylcholine active longer. So there's Spanish sage and rosemary essential oils. Some of these do help to slow down acetylcholinesterase, but unfortunately, there's no way to just take acetylcholine and have a subsequent increase in the brain. Good question.
All right. Now, I know this is probably going to be a tricky one, but someone wants to know what is the best way to reduce inflammation in the body?
Wow. That's the $6 million question because if we could reduce inflammation in the body, we would prevent or stall the progression of 90% of the diseases that cause us ailments. I often say if we handed a bottle of curcumin to every kid that graduates from high school, and they started to take it immediately, we'd probably add 10 years on average to their lifespan because reducing inflammation is that important. Now, the way to reduce inflammation is to eat healthy, eat clean, but you've all heard this before. Get good levels of activity. I'm not a big believer in excessive physical activity like marathon where you overstrain your body, but make sure you're up and moving every single day. Do something that you love so that you stick to it. Curcumin is the best. There are other compounds that sometimes you might blend with it, like, for example, in certain situations, adding boswellia to curcumin gives you better levels of overall ongoing inflammatory relief than curcumin or boswellia alone. I love the turmeric essential oil that is present in some curcumin products because they're finding that there's turmerones and turmeric essential oil that are, when they're concentrated, also have very beneficial anti-inflammatory effects. So there's no one way to reduce ongoing inflammation, but it should be the goal of every single person in America.
That is excellent. Now, last question here is I know you have other things that you need to tend to today, but for someone who maybe is on a low income or fixated budget, would you say that, curcumin might be one of the foundational products that they should be trying to use if they're, trying to incorporate more natural medicines into their daily regimen, or any other advice for someone who, doesn't have a lot of money to invest into some of the natural products out there?
Oh, I absolutely hear you. And I wish that we had a better system in place. In Germany, if you're low income and you need clinically studied, clinically proven herbal interventions as part of their healthcare system, not so in the United States. I would say that it's, choose your food wisely, eat as healthy as you can, shop the periphery of the grocery store. I know it's more work to prepare fresh food, but your benefits will be abundant. And if I only had to use, for most individuals, if there was only one supplement in the whole wide world I could buy, it would probably be the curcumin blended with turmeric essential oil because it's something that addresses the foundations in the body, the ongoing issues with oxidative damage and chronic inflammation. And it's so useful for so many things and works at such a basic cellular level that I would probably pick that. So depending on what your budget can bear, there are lower dose formulas out there. Even getting a little bit on board, I think, is better than not using it at all.
All right, my apologies. One more just snuck in here, but someone who has a husband with Parkinson's, and she's read some information that it might have an autoimmune component, and some people have said that elderberry should not be used for people with autoimmune diseases. Do you have any information about that?
Well, many compounds that help individuals who are infected with a pathogen, so colds or flus generally, or it could be bronchitis or pneumonia or something along that level. You want to stimulate the immune system so it jumps into action so that it helps kill the germs faster. That's how you recover, is to kill off the germs. Now, when you look at certain compounds like echinacea, when you take hundreds of milligrams, that's a very potent immune stimulant. Elderberry is not quite as potent an immune stimulant. So I'm not as worried about elderberry with people who have Parkinson's disease. However, to be on the safe side, discuss it with your healthcare practitioner to weigh the risks and benefits of, which is the greater risk. Is it going to make the Parkinson's worse, or is it more important that you get over this disease quickly because you don't want it to turn into something more serious? Additionally, for Parkinson's disease, I would recommend that you think about curcumin and turmeric essential oil, and also supplementing with, there's a French sublingual glutathione that's available on the market that does the best job I've seen at raising glutathione levels in the body, because glutathione gets destroyed by the digestive process, unfortunately. Even another one of those compounds that are super hard to get into the body intact. But there's some really promising work being done on Parkinson's disease in that area as well.